So good afternoon. I feel a little bit awkward because I'm not from the university. I am from the Association of Schools and Programs of Public Health. My name is Tim Leshin. I'm the Chief External Relations and Advocacy Officer there. And I'm sorry to say I'm kind of responsible for you all being here because it was our idea to really flip the script and make sure that we were listening to our communities. As opposed to trying to tell communities what they should be listening to. So the Association of Schools and Programs of Public Health is a national organization that represents 155 schools and programs across the country and the globe. And we are very proud to have Fairbanks as one of our members, our active members, and we'll talk a little bit more about that in a minute. So today's event is part of a national listening tour series that we designed to create space for honest reflection and shared learning and dialogue across the academic and community public health landscape. It's a bit of a mouthful, but you get it. The idea is to actually listen to one another and learn from our communities. And this is the inaugural event for our listening tour. We've had other events at other institutions, but this is the first listening tour. Before we begin, there are a few technical things. This is a hybrid event. People are joining us on Zoom, and we're very grateful for that. There will be Q&A that people on Zoom can add to online on the Q&A feature, and we'll have audience Q&A at the end as well. At the heart of today's discussion is the principles that the community is our teacher. This session is not about debate, nor is it about academic institutions' precedent awareness. This is really instead about listening carefully to the lives and the lived experiences in sight of leadership and communications. Across the country, communities are developing solutions to public health challenges long before they appear at the national headline, in the national headlines and academic journals. And we want to recognize that. We were very fortunate to be here yesterday and go into some of the communities that the School of Public Health is working with, and really we're blown away by the community activization, that people are having in your communities in terms of helping one another from the ground up. So the listening tour is also builds on our themes at ASPPH, leading out of a big retreat that we had with many of the deans of schools and public health, where we're really trying to build a stronger partnerships across communities, reclaiming trustworthy communications, and preparing students to work ethically and effectively in their communities. I think a lot of our schools and programs do that anyway, but we really want to refocus on that, especially in the face of some of the challenges that public health has faced. And I'm someone who really firmly believes that public health is a necessary component of democracy, and we need to make sure that we're giving people the idea that everyone is in their community can help one another, and that it's not just about oneself. It's about how can we work as a community to improve the lives of and the health of everyone. So that's really where we're trying to come from on all of this. I'm not going to go on and on about with my remarks because I want to get to the discussion, but I do have the real honor of being able to call the dean to the stage. And Nir Medicam is a very active member of ASPPH, and what he's been showing us at the School of Public Health has been just a crystal clear example of how community engaged work can really happen at a fundamental level in a community and across the state. And so I really want to thank Nir for having us here and co-hosting this with us, and appreciate all of you being here. Thank you. You. 'Cause 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 'cause
Thank you, Tim, for not only being here, but also for that nice introduction. So good afternoon, everyone. On behalf of the Fairbanks School of Public Health, I want to extend my gratitude to ASPPH for being here with us today. We're honored not only by your visit, but also by the opportunity to be part of this national listening tour and contribute to that broader conversation about the future of public health education and practice. From its founding, and I know those of you in the room who've been part of the Fairbanks School know this, our school has been built on a simple but powerful principle that a school of public health must work with the community, not just study it, not just work alongside it, but with a true partnership. Community engagement in our school is not a program, it's not an initiative, it's central to who we are. In fact, it shapes our research questions, how we teach, what we teach, our partnerships, and the way we define impact. I think our location here in Indianapolis, and more broadly in Indiana, uniquely positions us for this work. Many of you have heard me say that this is a Goldilocks state, not too big, not too small. We're large enough to reflect the complexity and diversity of health challenges seen nationally, yet we're also small enough so that collaborations across sectors is possible in meaningful and sustained ways. We have urban and rural communities. We have advanced health systems with persistent health disparities. We have strong public health leadership at the state and local level. And we have structural challenges that we are constantly trying to overcome. In many respects, what happens in Indiana pretty much mirrors the opportunities and the tensions facing public health across the nation. That positioning allows us to test ideas, build partnerships, and implement solutions that are both locally responsive and frequently nationally relevant, whether through initiatives like projects and activities, dip incomes to the forefront of my thinking, our workforce development efforts or other engagements that we have with state and local agencies. We are committed to ensuring that academic public health is practical and accountable to the communities that we serve. I can't wait to hear this panel. The discussion today about the state of public health in Indiana is an important part of that commitment. It gives us a chance to reflect honestly on where we are, what are we learning, and how we can move forward together. I'm pleased to introduce Dr. Tom Dzinski, who's going to be the moderator for the panel. Tom is an assistant professor of epidemiology and our school-wide MPH program director. Tom brings experience as a former epidemiologist with the State Health Department, where he led surveillance and investigation. And as a result of his experiences, has firsthand knowledge of how public health systems operate under pressure. I think his perspective that bridges both academia and practice is part of the spirit of what I think this discussion is about. So thank you all for being here. Thank you to our panelists for your willingness to engage in this important conversation, and I will turn it over to Dr. Dzinski.
Thanks, Dean Menachemi, and good afternoon. Thank you. I teach classes, so it's going to be engaging. So as someone who has spent more than 20 years in the field of public health, from an environmental health specialist at a local health department to director of surveillance and investigation for the State Department of Health, I recognize that public health does not happen in a vacuum, right? It happens in that interconnected space where academic research, policy, and the lived reality of our neighbors meet. Today, we are talking about that interconnectedness, but it isn't about linking institutions. It is about the fundamental necessity of listening to perspectives different from our own. In our current climate, one of shifting public trust and complex health challenges, being able to step outside of academic or professional silos is not just a soft skill, it's a survival skill that public health needs to adapt in the next decade. Real progress requires us to have the humility to listen to voices we don't always hear. The community advocate, the student with fresh eyes, and partners who see the barriers that we might miss from behind the desk or a data set. This interconnectedness, where academia doesn't just study a community, but is accountable to the community. It is the only way we will build the resilient, trustworthy systems that our public deserves. So we are joined today by a panel that represents this diverse viewpoints. I look forward to an honest dialogue on how these different perspectives can challenge us, teach us, and ultimately help us co-create a healthier future. So with that, let me change camera angles so that everybody can see you now on Zoom. Let's begin by having our panelists introduce themselves, and we'll begin with Dr. Valerie Yeager. Dr. Yeager?
Thank you.
Just give it a second.
Thank you, Tom. Hi, everyone. I'm Valerie Yeager. I'm a professor in the Policy and Management Department. I am also the director of the Center for Health Policy, the research hub of our department's faculty who are conducting research with our community partners and other types of national awards.
Good afternoon. I'm Linda Alexander. In 2022, I got my dream job and became the Chief Academic Officer for the Association of Schools and Programs of Public Health. But prior to that, I spent about 40 years in community-engaged participatory research. And it's with that lens that I'm honored to join this panel.
Hello. Okay. Hi, everyone. My name is Alexa. I have not received my dream job yet, but I am at my dream school. I am a public health major here at Fairbanks. I have been a school liaison for almost 2 years, and I have worked at vaccine clinics, stop the bleed, and CPR trainings.
This is on. Okay, good. Hi, I'm Mary Claire Malloy. I am a health reporter at Mirror Indy. It's a nonprofit newsroom. We started about more than 2 years ago, and we cover the community of Indianapolis. My investigative work has been recognized by the Society for Professional Journalists in Indiana and the Association of Healthcare Journalists nationally.
Hello, my name is Veronica Holloway. I am a peer education program specialist for Step Up Incorporated here in Indianapolis. My role is to help facilitate, maintain, support everything that has to do with the Indiana Peer Education Program, where we are active in 12 state prison facilities, spreading public health knowledge through trainings and just being really intentional about being a part of changing lives, basically. We have the opportunity of working with the School of Public Health here. Shout out to you guys. And also the Indiana Department of Health, where we are currently in 12 facilities and about to break into our 13th very soon.
Good afternoon, everyone. My name is Carlina Moses. I am the Near West Community Builder, and the Near West is made up of 4 amazing neighborhoods: Hallville, Hawthorne, Stringtown, and We Care. It also includes Central Greens, which previously was Central State. In my role, I would say the most important aspect of my role is upholding the Near West Quality of Life Plan, which was created by the neighbors, stakeholders, educational institutions, and I foster collaboration, I listen, and I roll my sleeves up and work alongside the neighbors in those communities. Thank you.
Wonderful. Thank you, everybody, for attending today and helping us with this important discussion and helping ASPPH with listening to what's happening in communities. So we sincerely appreciate that. So I have some questions for our panelists to get us started, and then we'll open it up to questions in the audience. Anyone online can certainly type their question into the chat room. It's being monitored as we speak, and then we'll get to those questions as well. So to kick us off, Dr. Yeager, from your experience, what specific actions by public health institutions help build trust with communities? And then what behaviors most quickly erode it?
Thank you for the question. When we were given these questions to think about in advance, and so I thought to myself, what does a public health institution mean? And I think it is an inclusive word, which is going to be the theme to my response. It involves governmental public health agencies. It involves the NGOs that are doing public health focused or related work. It involves academic institutions and our students and faculty and staff. And so if we're thinking about
what actions those organizations are conducting that builds trust, I think the immediate, like, first of mind thought is trying to be inclusive, and not being inclusive just in the moments where we're obligated to work together, but working together and supporting each other and getting to know what those others are doing in our day-to-day lives. So that's knowing what Step Up does and what they're doing with individuals in their communities, and that they're working with the Marion County Health Department and they're working with the state health department. And so when we see each other at those events, we can connect about their recent accomplishments, or we can celebrate some of the changes that they're making for the community. And as many of us in academics are touching on different projects and working with these partners, we have a role, I believe, in helping build those bridges across the institutions, because everyone's really busy. And so we don't have time to go to everything. And so if we can find various ways to support one another and know about the community needs that we're each focusing on, it builds trust. It also gets us working together when really important initiatives begin, because we already know each other. We don't have to start from scratch. So for those of you who are familiar and those that aren't, our state recently received a substantial state infusion of funds to support local health departments. And immediately those local health departments turned to all their community organizations to say, we can do this together. Local public health agencies don't need to do all of this by themselves. And if they didn't already have those roles, there wouldn't already be trust. And so by having that as an ongoing expectation and priority, I think it's really crucial to ensuring that when opportunities arise, we can make the most of them together. I think we erode that trust by leaving voices out. So there are key members of our community who are often overlooked or who might not be represented by an organization. And I think it's our responsibility to keep looking for ways to make sure that their voices are heard.
Wonderful. Thank you, Valor. Carlina or Alexa, do you have some additional thoughts about helping building trust from public health or in the communities?
Sure. So I think, like Dr. Val said, it's important to be eye level with those in the community. And that means sitting down with them, listening to their perspective. They live in that community. Those are your local experts. But I would also add that creating a plan for sustainability. When you tell a community that you want information from them or you want to walk alongside them, you have to commit to that, or it breaks trust. And if that trust is broken, it is challenging to regain it. And so if you say, we're coming in, we want to work with you, then you have to show up consistently. And I would also echo, bringing more voices to the table, people of different abilities, and just being thought partners together. Otherwise, it just really could damage and cause harm.
What I will add is, from my experience working at clinics, being a student as well, I would say when you're working face to face with a client, with an individual, or with a family, taking the time that they give you and taking into consideration that their time matters as much as everyone in the rooms, everyone in the county. When I've worked at vaccine clinics are fast paced. We have such limited time to get everything done. But when one individual comes to you, asks you a question, don't rush them. I would say, like, my biggest motivation is when someone's question is being answered and they're like, oh, thank you. And it just changes their whole day. I feel like as public health, that's like what we should strive for.
Yeah, brilliant, brilliant. Veronica, when communities and universities like IU work together, what do you think universities most often misunderstand or overlook about community priorities and realities?
First of all, thank you for this question. I absolutely loved this. So when we were given this opportunity to kind of see these questions in advance, I gave it a lot of thought. And having had the opportunity to work closely with academia through running our MPEP program, I have seen kind of like the best side of this. And I think one of the biggest things that gets overlooked at times is a level of cultural competency. And when I say that, I'm not speaking directly to ethnicity or race. I'm speaking in a more broad fashion, non-material culture, shared history, culture, the culture of the community, contextual themes, having a deep understanding of those nuances while planning support initiatives, I think is vital. It saves time in having to pivot once those nuances and contexts are learned. What might be beneficial in an urban community might be detrimental in a prison community, for example. And having the ability to go in with that level of knowledge better prepares those who are providing the support and the service, and it establishes trust from the community that these individuals have taken the time to understand us, to understand the culture of our environment, what will work, what won't work, what we value, what we don't value. And that just enables for a more authentic partnership between the community and academia or universities as a whole. I think personally that those relational dynamics of the community should be outlined and mastered and learned before any solution implementation takes place, to ensure that whatever plan of action is established is going to benefit both those providing the service and those receiving the service.
Yeah, so listening to the community. And I think you touched on a really important point of cultural competency.
Yes.
Right? Do you want to maybe expand on what you mean by cultural competency in that dynamic?
Absolutely. So, for example, what I do every day is I support my peers, my colleagues that are currently housed in 12 of Indiana state men's and women's prisons. And that culture is very different from a suburban culture or an urban culture or an academic culture. There's different language, fashion, dress, food, priorities, time management, like all of those things differ in that community. And that is a community of people who have a common goal, and that is frankly to go home. 96% of all incarcerated individuals in the state of Indiana will be returning to their home communities, their home counties. So 96% of them have that common goal of going home. So most of what occurs in facility is based around that shared common goal and survival. And that looks different in each facility, but there's a baseline of similarity. So before academia goes into that community, having an understanding of those cultural nuances is kind of what I mean by cultural competency. Going into communities outside of the fence, understanding how families are structured, understanding why it might be disrespectful to tell the woman to get a part-time job or suggest that a woman works outside of the home, understanding that that could be not only detrimental to the family structure, but maybe even her health and well-being, simply because of a cultural difference. And having that knowledge, having understanding of medical mistrust in certain communities, and walking in with that knowledge would better equip everyone of receiving services and giving services.
Carlina, did you have some additional thoughts? You could say no.
Can you repeat the question?
Sure. When communities like IU work, or when communities and universities work together, what do you think universities most often misunderstand or overlook about community priorities and realities?
Okay, I do have a response. I think something that is often overlooked is that the solutions exist right there in that community. I come with an asset-based lens, and what that means is thinking through what exists in the community right now, the people, places, and things that are assets. I would argue that there isn't anything in the community that is not an asset. It's just shifting your focus to how can we utilize this to reach that common shared goal that we have or to move this initiative forward. And so taking a look at a community and saying, we as an institution want to come in, we want to come alongside you, but do some asset mapping alongside the members of the community so you know what they view as assets and you come together as thought partners to then apply any plan that you plan to implement. But just realizing that there are assets that exist in that community and you can partner with them to just create beautiful things and enhance the quality of life of everybody involved.
Thank you, thank you. So Linda, if you could redesign how public health schools engage with communities from the ground up, what would you keep and what would you change?
So again, I love these questions, and I asked to answer this question, but we don't have time for my full redesign. But I will say this, universities and schools of public health, with the exception of Richard Fairbanks, were not designed with the communities in mind. So it's a little ironic that the social justice mission of public health is often overlooked by universities, but universities have different structures, different power systems, and different ways of organization and a hierarchy that doesn't align with community needs. So if I could redesign a system, there would be equal distribution of wealth, of power, and equal respect of ways of knowing. There would be an appreciation of the roles of staff, and I'm saying that with intention. In many ways, schools are hiring staff that come from communities. And these staff often, in many instances, could be the front door for the shared knowledge and for the things that you've heard this morning from the panelists. And so perhaps there should be a consideration of staff as more thought leaders and not simply administrators. I'm thinking of the grant process in particular, when staff are asked to make phone calls or organize meetings and those type of things. And I'm not looking down on that work, and somebody needs to do that, I assume. But I think staff could participate more fully as thought leaders. And so the structures for tenure and promotion, the reward systems, even the way that money is often distributed or not distributed to communities because there's something about the system that doesn't allow for certain payouts and that kind of thing. So it would be more redesigned. I think you have a model in Indianapolis that we could all follow.
I love that answer because I like the idea of engaging people that are doing the work at the ground level, right? And making them thought leaders. That's really insightful. So Alexa, as a student, do you have any thoughts about how we should rebuild schools of public health from the ground up if we could?
I would say, no, you guys are perfect.
I would agree, but I'm biased.
I would maybe increase student engagement. I feel like it's hard for public health students to find opportunities to volunteer at, to maybe job shadow. I know this as a student, maybe sending an email isn't as like, okay, so we get like 10 emails per day from student campus saying, oh, come over here, come over here. And when we get those same emails, I'd rather someone come into the classroom and saying, I want you there. I feel like we should improve on how we engage with students.
Like that.
and how we bring them into the programs here.
So more of that personal connection as
Yeah.
opposed to an email. Let's reach out and talk to one
Mhm.
another.
Yes.
I like it. I like it a lot. Wonderful. Mary Claire, what does real impact look like in the community for you?
So I'm looking at this from a journalistic lens, which is a little bit different.
Yes.
But as someone that covers communities, an example I can give you, we are thinking about community-based journalism. It's not just we talk to the politicians, we talk to the experts, we get the data, though those are very important for a story. It's who has lived experience, who is most impacted by an issue. And it might just be someone down the street that you've never asked the question. So an example journalistically, I worked on a year-long investigation into a mental health facility here in Indianapolis where patients were coming to me and they were saying, I'm being held against my will for insurance money. Police reports show widespread sex abuse and just constant issues with staff being aware of what's going on. And these things went on for years, and people felt really unheard. They felt afraid to share because mental health is so stigmatizing. And doing this investigation, it had real impact. People felt heard. They joined lawsuits. They spoke out. The clinical director resigned as a response to the reporting, and ultimately the facility shut down after 5 stories and a lot of no comment. And so I think that does show real impact of people feeling heard and seen finally after a lot of being swept under the rug. And so that is what I'm looking at. Also, lawmakers are now having discussions about how do we oversee these facilities? How do we streamline complaints? So it's not just let's shut it down and pretend this is going to stop here. It's going to continue in other places and with other companies. So I'm really happy that the story started that dialogue and made people feel seen and kind of lessen that stigma.
Nice. So for the rest of you, is there a couple other words that you'd say, oh, this represents community impact for me? When I see these things, this shows me that it's been impactful. Veronica? Or I'm sorry, Carlina?
Yes. So I actually have the privilege of serving in the same community that I grew up in. My office, Hawthorne Community Center, is the convener for my role. And so my office sits in the building that I went to summer camp in. I played basketball there, went to after-school programs. And I think my love for wanting to do in community came from being surrounded by adults who were pouring into youth and families in a community. It impacted me so much that I couldn't tell you what I wanted to do. I couldn't tell you the name of the career. I just knew I wanted to work with people and be supportive and serve. And so I also have the privilege of sitting on the Near West Dip-In Steering Committee right now. Dip-In has created this beautiful model of bringing community members together to look at grant proposals, to be thought partners about like, how can this work for this community? Or is this something that this community even wants? And I sit in a very unique seat where I spend a lot of time at meetings, community centers, educational institutions, the city, and I get to see so many people in the community that grew up in the same community that I did, and they are serving and pouring their gifts back into the communities that served them. And so I would say that's one of those qualitative impacts that you probably can't even measure if you tried, but it's that ripple effect of somebody getting bitten by that beautiful love bug of giving back to the community or discovering what their gift is and finding a creative or unique outlet to pour it back into community.
Do you want to, maybe I know a lot of people in the room know what Dip-In is about, but maybe for the people online, could you just give us a brief description of Dip-In?
Yes. So Dip-In, wow, it has so many arms. It is a program that has allowed, like they've come into the community as a partner through the Fairbanks School of Public Health to say, hey, listen, like we care about driving down these numbers associated with diabetes. And if you do any research, you know that Indiana is high on that list. And so Dip In has this fundamental way of saying, if we're able to introduce this concept or this program, we can help drive those numbers down by making sure that individuals have access to information about diabetes or information about A1C levels. I'm not diabetic, but thanks to Dip In, I understand the importance of knowing my A1C level. I understand that me being able to walk just a couple times a day is enough to help improve my quality of life and lower the risk of me getting diabetes. Same for the neighbors in the Dip In catchment areas, making sure that those youth have access to programs to help them stay healthy or learn about nutrition, their parents too, and working alongside individuals who can, like a community center who says, yes, we will open our doors. Yes, we want this yoga instructor to come teach our youth about the importance of yoga. And those kiddos being so excited that they're telling their families about it. And now we have a proposal to make sure that the parents can attend yoga class, or that the seniors in the community have access to nutritional education. Just different. Dip In has found such a unique way to say this is an attack on diabetes, but it's a way to bring our communities together and make sure those areas that have the most vulnerable populations have access to immaculate public health, and it's just a beautiful thing.
So really utilizing a lot of those things that we've been talking about, right? Within the community and engagement and cultural competencies, and one size doesn't fit all, right?
That's right. One size doesn't fit all, and they know that because they sit down with the community. They listen to the community. And when individuals are creating these proposals, they're listening to the community too. They may have this beautiful, brilliant idea, but then you're face to face with members of that community who can tell you, yes, this is a great idea, but we want you to know you may not be from the Near West. We have a huge Hispanic population, so we want to make sure you come into our community with the right tools. We want to make sure that the materials that you're going to be sharing with our families are multilingual. We want to make sure that if you're going to do an educational class in this community, that it is presented in more than one language so that everybody that's coming can benefit.
Brilliant. Valerie.
I think I'd like to just repeat the question because I think the way you've asked it is really important. What does real impact look like in the community? And we can define impact in many different ways. We can also define community in many different ways. So just from my co-panelist perspective, Alexa represents our student community. And Linda brought up the importance of our staff as a part of our community. And then we have what we typically think of as community, which are the individuals that live in the area that we're speaking of. And so when we measure impact, it can be, did we change health? It can be, are people in the most fundamental way happier and living a more fulfilled life? And so public health and population health focused work is about reducing those barriers that stand in the way of people achieving what they believe to be fulfillment. And in so many ways, health relates to that. And so I think we are having an impact if we are helping our students get their dream jobs. And if people like Carlina are able to do the work that's meaningful to them, and if in Dip In communities or the Indy Health District, those individuals are telling you that they can finally go to a grocery store without a 30-minute commute, we are creating impact. And so we define it through a variety of ways. And I think it's important to put it in the perspective of who the community is.
Wonderful, wonderful. So, Veronica, many claim to work with the community. From the community's point of view, what makes real involvement different from involvement that just is for show or for benefiting the outsiders?
I think something that kind of marks the difference between like real community involvement and community involvement just for show is the work moving beyond data collection. It's great to be able to go into communities and to understand and to collect information and to observe that information and pick it apart and create these great findings and all of the things. I think that is fantastic, and I think it is very, very much needed. In the same sense, once action is put towards those findings, once that information is quantified in a way where we can develop a plan of action, I think that is one of the markers of real community involvement as opposed to just kind of doing it for show. And I have to give the Fairbanks School of Public Health their shout out. I see the work that they do in our program in terms of quantitative and qualitative data, and it is vital to our program. But I also see them taking that data and going back to our peers and colleagues and saying, look, this is what we see. This is what we have found is working and is not working within our program, and we would like to know what can we do with this information to make this program more robust for you, to help benefit you both in facility and upon your release. So I think that's an important marker. Another is when that information, like I said, is kind of translated into tangible change, not just a plan on paper, but something actionable, something time dependent, like all of the SMART goals. Like when those are actually put into use on an academic level, I think that it could be a beautiful thing for our community. I think authentic involvement is solution oriented. We all want to learn more, but if that learning and doing does not result into a solution that is beneficial for both the one providing the service or support and also the one receiving it, then we have to ask ourselves what we're doing this for. And sometimes it can lean a little bit towards the show. I think that community members may not always be able to articulate the systemic need for what they need in their communities, but they can articulate the lived impact of what they have not received in their community. And that lived impact, that lived experience, like you were saying, is valuable. It is an asset. So having that information be received as another data point and not just like a testimony, not just another story we heard from the community, but having that received as a data point and used in the development of programs and services for a community is vital. Responding to that lived impact of the systemic issues that they may be facing, while honoring the expertise of their lived experience, because it is, like me and Andrea were just talking about, it is a credential, just like the master's degrees, the PhDs are credentials that provide expertise in an area. Lived experience is a credential that provides expertise in an area. And when that is taken into consideration and measurable steps are made for improvement, that's how we know that we are truly invoking change and not so much just getting another great research paper or another great byline or another great accolade to add to the collection.
So it's not just about what's in it for me as a researcher. And I think you used the word authentic. Tell me what you mean by being authentic in the community.
I think a big part of authenticity is like humility, to be honest, to be able to say, I may not understand, I may not have ever been able to share your experience, but because you have had that experience, please teach me what you can about that experience and allow me to receive that information in a way that is impactful, beneficial, helpful. That level of authenticity, or in this case, humility, brings about authenticity. I trust someone a lot more when they're able to look at me and say, I want to help you, but I don't understand. And that gives me the opportunity to explain what's needed in my individual community, in the individual community that I'm serving, and not so much what the the greater good might need. We can kind of bring that into the community that we're working with, the population that we're serving. What can we do to benefit them instead of broadening that scope and being able to walk with humility, lead with your goals and your strengths? I think that provides authenticity in both serving and being served in general.
Absolutely. I appreciate that response. And your explanation of authenticity, I think, is a really important touchstone. So, Mary Claire, do you think, like from a community's point of view, what makes real involvement different than just for show?
So, journalism is great, but it can do a lot of harm when people feel like you only show up in their community when something bad has happened or when they are a statistic. It's a two-way relationship in the community journalism world that we're trying to foster, that I'm at that neighborhood meeting and I heard the question you asked, I heard your concerns, and that you can call me when the CVS that's vacant is not being cleaned and you want to know what's going on. Or you can call me when I've written about a program for underserved women who can get universal basic income during pregnancy, and you want to know how to get involved in that. So it's a two-way relationship, and that I'm not just coming into your community, writing a story and saying, bye. You can call me and tell me what questions you want to hear. You can tell me what you're concerned about. You can tell me if someone that's supposed to be helping you, an organization or a facility like the one I was just talking about, isn't doing that. So I think it really is about relationship building outside of the story that you're just writing, and also thinking, when I go in to write about this issue, that doesn't mean I don't know it yet. It's going to unfold for me, kind of not coming in with this preconceived idea of what the problem is, what people care about, because communities know what's going on. They know some of the solutions. They know what they care about and what they need, and you really just have to listen.
Wonderful. So, Alexa, as a student, what responsibilities do public health students have to the communities they learn from? And how can training programs better prepare students to engage ethically and respectfully?
I would say students have a strong responsibility in being patient and respectful, especially when we learn about health disparities, barriers in healthcare, barriers anywhere. It's a privilege to be learning all of this. It's a privilege to sit in a classroom and to hear your professor extensively talk about a strong topic like food insecurity. When you step out into the real world, not everyone has that exact same knowledge. So definitely being responsible for taking that into consideration when being face to face with individuals. And I would also say, when you are face to face with those individuals, as mentioned over here, don't let someone think they're just another statistic. Validate their experiences, validate what they have been through. And it's like holding their hand. You don't want to, someone doesn't just want to feel like that they're your notes. Yeah.
Yeah. So it's more about listening and less about, let me tell you what I know.
Yeah.
Yeah. Dr. Alexander, as an educator, what are your thoughts on this?
So I thought about this a while, and you all have just given such inspiring answers to many of these questions. What I wrote down was, you don't want to commit the ultimate sin, or, for those of you who think otherwise, transgression or affront to Mother Earth, okay? And that ultimate transgression or sin is taking knowledge out of a community without giving something back. And there is a unfortunate historical legacy, particularly for academic researchers, for having done that. So what we can do with students, I think, is it is incumbent upon us as faculty and leaders to make sure that students learn this as a part of their training and their trajectory of learning and going toward a pathway to their career is to not take knowledge out without giving something back. And what you give back is going to be beyond the internship or the practicum you have. What you give back is when you talk about the people that you learn about in your training programs, that you portray them with dignity and with respect. And I think you articulated that beautifully, and Carlina and Valerie, you all have as well. I think also that as a part of a training program, whatever you call it these days, it is imperative that you teach students that there were systems, laws, policies, and procedures that create the health disparities that are experienced by communities. People weren't necessarily born vulnerable unless they were in the ICU or the NICU or something, something of that nature. That we tend to talk about these disparities as though in vulnerable populations. This is something that happened over here, and that by some circumstance they created their conditions of living. Not that there were laws that were created so you couldn't get a mortgage, so you couldn't live on this side of the tracks, so you couldn't live on this side of the river. And I think we have a responsibility. Again, whatever we call that, that's history. That's written down. There's overwhelming evidence.
Absolutely.
And so I think programs need to be responsible.
Absolutely. So, Mary Claire, and this will be my last question for the panel before we open it up to the audience. Local communities often create solutions long before they appear in national public health conversations. How can local knowledge better inform and challenge national policies and narratives?
I always like to say that all national news is local news. Some version of a national health or political issue is probably playing out in your backyard among your neighbors right now. And there's definitely a lot of emphasis on the negative aspects and not as much solutions. But if you actually look at communities, they're already taking care of each other. An example I'd like to give is harm reduction. I have done some stories about overdoses, and there are all sorts of community-based programs, like people who are doing this work on the ground every day. And my job is to say, can I walk in your shoes? Can I come to your office? Can I hear about your lived experience? Because often, if they're passionate about this issue, they have a personal connection. So I think about talking to people just off the street who say, yeah, I carry Narcan with me because I know where these overdoses are happening, or I know that my family member needs it. And I got trained and I have it in my glove box. And there are communities taking care of each other already before the story bubbles up, and getting in on the ground and understanding that infrastructure is really important for storytelling. So I think just paying attention to what is going on in your backyard, asking people not just, okay, this is a really big problem, but what are you doing? Or who is that community member? There's like always somebody in the neighborhood that knows everything and knows everyone and connects everyone to resources, and go talk to that person.
Valerie?
Okay, so how can local knowledge better inform and challenge national policies and narratives? I think there's a couple different avenues that we can take in making sure that this happens. We are academics, and one of the things that is expected of us is disseminating what we learn. And we do that through a variety of channels. We write academic papers. We coordinate with organizations that care about the findings so that they can take those findings to their constituents. We work with Mary Claire and disseminate through the media in a way that puts the context around the findings into a language that can be understood by the average community member. How do these findings impact me? And we talked a lot over the last few years. Mary Claire and I have gotten to know each other. We see each other out in the community, and she comes to many of us and says, I'm working on this issue. Do you know somebody who could guide me? And so we disseminate what we know through those channels. As a result of some of the public health system studies that we led during COVID, and then the Governor's Public Health Commission, which ultimately made a recommendation for those new funds in our state for local health, my colleague, Katie Hiltz, Dr. Katie Hiltz, and I approached the Association of State and Territorial Health Officials and the National Association of County and City Health Officials and said, some of what's happening in our state, we've received requests from others in other states to learn about it. Would you like to work with us on a national webinar? We can have some of the local health officials and a representative of the state health department come and talk about the experience and what it's meaning for direct practice in our state. And that webinar was attended by hundreds of people. And that type of dissemination is just as important as academic papers because that leads to awareness that creates informal and formal networking. As a result of that webinar, the Wisconsin Public Health Association reached out to me and asked if I would come and speak to 500 members of their public health practice community. As a result of that, their state health commissioner called and asked if I could give her ideas of what I've learned from public health experience in Indiana. And so these formal and informal networks are also key to how we take local experiences and make them into implications throughout the nation.
Wonderful, thank you. While you guys aren't off the hook yet, we're going to, so these are microphones, and I'm going to pass one here to Shandy. If you have a question, we ask that you wait till a microphone gets to you, simply because we have a lot of people on Zoom and we want to make sure everybody can hear. So, Shandy, did you have a question?
I do. So since I have it, I'm going to go ahead and jump ahead of everyone else. So you guys offered great inputs. Thank you so much for your time with us today. So I want to ask about shared leadership. So it sounds like you're all having the same goal of true shared leadership. What does that look like in working with academic partners when you're thinking about accountability and resource sharing and decision making?
Anyone can take this.
So sometimes it's really hard to get a human on the phone when you're on breaking news deadline or the CDC has just scrapped the childhood vaccine schedule. Everyone's confused. You're confused. I like to say that, please explain this to me like I'm a fifth grader. I want to be the dumbest person in the room at first, and then you can educate me, and then I can put that into words for people to understand in a conversational tone. So I think being able to have this relationship like we do, where I can just text you and say, I'm looking at this line in my story and I don't want to create more fear because the government's saying this and then parents are saying this. And being able to have that personal relationship where you can help me, really massage that language, that makes my job easier. And that's sort of the element I'm thinking of, is being able to reach you and not go through a PR team. That is really helpful in terms of doing my job. So I don't know if that fully answered the question, but from journalistic perspective.
Okay. Thank you.
Sure. Veronica, did you have a follow-up on that? No, whoever wants to go first.
I just wanted to say that in public health, leadership is not just one person. So shared leadership is a must. Throughout my time working here, I have seen people working together and sharing different experiences, sharing what they see. I feel like it's important when planning something, planning a program, before planning, we all get together, we all collaborate, and we all share what we think. Versus when everything's finalized, one person drafts everything and then shares it out. Okay, this is what it is. There's no collaboration there. Yeah.
Thank you. I think I'm in total agreement with what you just said, and that leads to piggyback off of your point. I think that in terms of shared leadership, collaboration is vital. I can only speak from experience and working with the School of Public Health so closely in managing the NPEP program. They are great at facilitating our monthly teleechos. They have a real skill set and making sure that that happens in a way that is beneficial, not only for us as those that are the hub team that manages the program, but also is something that is fruitful for our peers. And so being able to collaborate with them and to recognize that my expertise is 100% not in facilitating meetings, not a good one for me. But they are amazing at it and amazing at facilitating these like collaborative meetings where everybody has a voice and the didactic is always so intriguing and all of these great things. Being able to say that, hey, this is not my strong suit. My strong suit is one-on-one with the peers in facility, having conversations, finding common ground. My expertise is not in the academic side of what we do. So being able to say, you are able to lead in those areas where I am able to follow. And once we get in facility, that might be an area where I am able to lead, where they might be a little bit more comfortable in kind of allowing me or another one of our team members to do so. I think makes for such a beautiful balance, and it only enhances the experiences of the people that we are trying to support. It makes me a better professional. It makes our peers more knowledgeable. It allows them to see teamwork in action so they can take those skills and transfer them into ways to have a successful reentry and reduce recidivism rates. And I mean, I got to say, our program has about a 1% recidivism rate, if I do say so myself. But they're able to see those skills in action. We teach them how to facilitate, we teach them how to do all of these things, but then they see 3 partnering organizations collaborate where no one organization takes the lead in any area that is outside of their area of expertise, and that expertise is respected. And I think that that is what makes for positive partnered leadership.
Yeah, that importance of leadership, of knowing when to step back, listening to the skills that other people have and allowing them to use them, right? Good. Other questions? Just raise your hand. We'll bring a microphone to you or throw a cube at you.
Thank you. This is weird. Whoa. Hi, guys. You did so well. Hi, V. It's so nice to see you up there. This is actually for Dr. Alexander. I was curious about, you spoke on something when you were speaking about being aware of how laws and policies were created that really drives the health disparities we see today. And I'm curious to know, how is that something that we can communicate with our communities without sounding as though we're the authority of their own lived experience of like, well, of course, those communities that are impacted by those policies would know that the best. And so how do we show that not only are we educated on this, but we also want to make sure that we are doing right by those communities and recognizing even someone who works in an academic institution, understanding the harm that we've done to communities. I mean, think of the Tuskegee experiments and the way that we, targeted Black and Brown communities for our own gain. So yeah, I hope that made sense.
That's a wonderful question. And I don't know that there's one pat answer, because I think as we have talked about things today, it might depend on your situation, your university, the courses that you attend. I do think that there's an appropriate lens that we can teach and provide and model for all students. And that, I think, has been articulated with this notion of eye level that Carlina talks about, this notion of cultural competence that Valerie talked about, and this notion of humility. I think that we can just prepare students to be open to and receptive to that without providing you with a wand or something where you're empowered to go out. What I tell my students who have, very fortunately for me, in all the years that I've taught, have embraced their notion of advocacy and activism and being social justice, regardless of their background, their race, their religion. But what I've tried to teach them is do not center yourself. Do not center yourself as the long suffering. Oh my goodness, look what we have done to people. What you need to do is be educated and be aware for when that opportunity does come so that you can be appropriately responsive. But the thing not to do is feel empowered to go out and say, I know the trouble that you've seen. I've read about it. I've learned about it. I've studied about it. You want to take a back seat until you are invited into those conversations. And then you want to thank people for sharing that with you, like Tim and I did yesterday when we learned from the community about redlining in some of these examples. And I think one of the exercises that I had my students engage in is that they had to read newspapers about certain things before the 1960s, and they literally had to read the newspaper or some printed document. I had a librarian come to my class and teach them how to use microfiche and go in and find stories. It was a humbling experience. So not on TikTok, not online, not to read something in print, the front page of a newspaper that highlighted a lynching or how somebody's land was stolen, that type of, it has a profound experience on you. But to be receptive to that knowing and entering in with a mindset that I understand these disparities, and I'm going to get an A on this exam because I can, write back about what those are. But in practice, how you allow that to shape what you're going to do next, and how you just respect communities, I think, who when they're willing to share that with you, that you say thank you.
So just like we're doing today, is listening is so important.
Exactly.
Thank you. Thank you, everyone on the panel. I'm very proud to be in public health, and I can see that all of you are as well. I want to bring up a topic, though, that might cause tension for public health, and that is shaming. Shaming people into behaviors that we think are justified, scientifically sound. All those things may be true, but whether or not that act of perhaps in academia comes across, that we have some authority to dictate certain behaviors to people. And I'm curious to ask Carlina and Veronica your experience in local communities as to whether or not that modality of trying to convince somebody to change their behaviors actually works.
Well, the short answer is no, it does not work. With Step Up as an organization and also INPEP as a program, we lean very heavily on harm reduction and exploring values. What I always say is that we are not here to yuck anybody's yum. Our responsibility is to present facts. We are not trying to change values. We are not trying to change belief structures because we don't know where that stems from, and it is not our place to dismantle it. So we present information, we give strong, actionable harm reduction tools so that we can say to anyone who needs us that we understand that you may not be ready to do something different today, but I'm going to make sure that you have the skills, the tools, and the knowledge so that when you are ready, you will be alive to make a different choice. And that is the catalyst for change, in my opinion, is meeting someone where they are without that shame component so that when they are ready to do something different, they know that they have a trusted friend in you to come alongside them and take that walk with them.
Thank you for this question. I like it. I think it depends. I believe that if you come into a community, there may be members of that community, even if you come in as gentle as you possibly can or authentic as you possibly can, if they've had an experience that was a poor experience with a different institution or a different organization or a different individual, they may be guarded, no matter, again, how gentle you come in. They may have that level of, oh, you went to this university, and so there's already a power dynamic, or you're coming into my community. However, I can use Dip In as a positive example where a model that they brought into our community and to other communities, I've witnessed this, and again, coming alongside the community to say, like, this is what the research says. We recognize that we need to partner with members of this community. We're going to share this pot of funding. We're going to open this up so that individuals can submit proposals that can drive change in your community. I have witnessed individuals engage in Zumba classes or engage in bike riding with their neighbors and inviting more of them to come ride alongside them or socialize with them. Or I've witnessed individuals say, you know what, we're at the senior community and we just want to be able to provide a meal for the seniors to get them out of their homes and socializing for 1 hour. And instead of saying, well, you need to do this because it's going to be detrimental to your health if you don't, but just offering that invitation of come have a meal with me, come join a kickball game, come join our bike riding club, or can we please host yoga at your community center? The approach is like that gentle approach and that invitation is what sets the tone and becomes the catalyst for driving that change that you would like to see, without coming in and causing harm and saying that there is this power dynamic because I learned this in class and I'm going to use your community as an example. But so I think it can, absolutely.
Answer.
You didn't ask me this question, but I love it. And I was in graduate school in the 70s, when dinosaurs walked the earth. And my training was in counseling psychology. And I had a professor that said, you all need to stop shoulding all over people. And so that was a mindset. But I'm going to give you something real tangible because it's a teachable moment. I'm glad you asked this. My research, my card-carrying research was as a tobacco researcher. And I studied the disproportionate use of menthol cigarettes with the African-American community because about 86% of African-Americans who smoke menthol. And I was a part of a research network funded by NIH back in the day. And communities were like Black communities who we thought would be allies for us when we didn't want tobacco in Family Dollar and those type of things. People said, why y'all want to mess with our cigarettes? What's up with that? Why are you going to take what we smoke? And so this reality of us coming in and, don't you want to march beside us to ban meth? No, we do not. And so that was that was an aha moment in terms of this shaming, I love what you call it, and not considering that you have a contingency of people who don't want a policy or change that's going to, in their mind, have a detrimental effect on them. And it takes time to bring people along. So
I love that answer. I was always taught you shouldn't should on yourself, right? That I should have done this, I should have done that, but I love the idea of don't should on other people either. Yeah. I said should, relax. Are there other questions? Liz, do you want to introduce yourself first?
Oh, sure. Hi, everyone. I'm Liz Mace. I'm also with ASPPH. I'm the Director of Communications, and we worked together on this event. I am monitoring the Zoom, and there was a question. They didn't give their name, but I'm going to ask their question. What advice would you provide to local health department staff in navigating overcompliance in fear of going out into the community because of the fear that the overcompliance creates?
Anyone want to tackle that?
I suspect what is implied by overcompliance is overcompliance with national changing policies and the potential of how that might be perceived in the community. So We spoke earlier today as a group about some of the changes that have been occurring in our funding environment and also our political environment that ultimately impact our local health practitioners routinely on a day-to-day basis now. And it's an environment that requires adjustment and finding solutions to still do the important work. So I think we have nothing but to exist in the world that we are currently in. And we are coming up with ways to do that. As programs are cut, local health departments are finding ways to meet community needs through other avenues or resources. They're braiding funds together to cover staff that were previously supported through programs that are no longer existent or no longer being funded. And so I think to be able to still authentically be a public health practitioner out in your community, it's being realistic that this is the environment we're in. We have to find ways to do the important work and exist with what resources we have. And that makes for tough decisions. But we can learn from each other. So if your local public health practitioners, your local health officials can learn from the National Association, County and City Health Officials. They bring together people to share what's working, how they're adjusting. States have an organization that convenes the health officials from those local health departments to see how they're responding to policy change in their communities as well. So there are networks where you can learn from each other and how we're adjusting. Others? Anybody?
Alexa?
Mine's a short answer, but I would suggest meeting people where they are and using the resources out there. As we learned with COVID, we use Zoom meetings. We call people if they can't transport to us. So definitely taking into consideration that we can travel to these people. We can communicate with them that's not in person. Yeah.
Oh, that's good. Other thoughts for anyone? Carlina?
Oh, sure. I would just add connecting with the doers in the community, because chances are if someone's no longer showing up to their health appointments because there is a barrier, well, there's a lack of trust or there's some fear, they're contacting somebody that they trust in the community who they feel like they can go to for advice or the words that come from that person, whether that's a case manager, a member at a trustee's office, or a local pastor. I mean, there's somebody in the community that they do trust that they're going to and they're asking questions, and those individuals need someone to collaborate with to uniquely meet the needs of that individual or their family. So learning who the doers are in the community and connecting with them and making them part of your network to inform the work that's being done.
Love it. So we are getting close to time. So I think I've got room for two more questions. So I think there was a young person here. So there and then up there. Adria, do you want to start down there?
Hello, thank you for this discussion. Even though I'm not like a public health major or anything, but like my internship has really been like an eye opener to all these topics. But my question is like with you, when you said you've always known that you wanted to help people, you wanted to be in this service, but you didn't know like there's a specific major for it. So I would say like, how do you think professors or like just in the academic field are able to make it known to students like, oh, there's this specific major that relates or connives or that like aligns with your values and what you want to do for yourself, and like kind of like, is there like also an opportunity to be able to like get to have an insight of what the major is all about, or like just being in the community and being able to serve them?
Thank you.
Thank you for the question. I would say something that professors could do is connect with members of the community. Rather, that is connecting with local educational institutions, so like the schools, the high schools in the community, or even the middle schools, but also community centers. because you may learn that somebody at the community center is who leads the neighborhood association or is a participant. And so just finding ways to connect with those members of the community to talk about how what your school offers is for everybody, or it's for somebody who has that unique passion. I didn't know what a community builder was before a few years ago, but I can tell you something that is just special about it is who you do connect with, and just being open to the different possibilities. If you want to shadow somebody, I will give you my information. You're more than welcome to shadow me in the work that I do. But I think just not being afraid to ask questions and connect and say, how can we work together so that we have more public health students coming into our programs? We're feeding that passion, and we're letting people know that there is a direct pathway to reach the ultimate goal of getting your dream job.
Wonderful. Last question, Dr. Kearney.
Hi. Too often in my observation, when an academician wants to involve this should be shaped of a football, by the way. It should involve once community engagement. They see a problem, they come up with an idea, they write a plan, then they go and look for somebody in the community to be served on as a community advisory board. Another model that's being pushed more recently is saying that how does that person know what the problems are and what the potential solutions are since they don't live in that community, but rather engage the people of the community up front when you're thinking about the problem, and so-called community investigators, and keep them involved in the project from beginning to end, and maybe across multiple projects. My question is threefold. One is, how do you suggest an investigator identify the people who could be potential members of that research team? Two, what type of preparedness do they need so they can be active participants and not just there for show? And third, how should they be compensated for their time? Too often we expect these people to volunteer their time while we're getting paid in academia. So what would it be appropriate compensation for that? And then how do we make that sustain so that these things happen over time?
Great question. So something that comes to mind about sustainability, I want to answer that one first while it's fresh on my mind. I think about the relationship that the community has with Dip In right now. I don't know that Dip In's going to be around in 2027, 2028. I do know that right now, that is my connection to this Fairbanks School of Public Health. I think it's important when you have a plan of sustainability, even if a program is no longer going to be in existence, that there's a warm handoff and there is still a nurtured relationship that is moving forward, so that if there are other opportunities that arise, you have an opportunity to discuss those, and you're not saying, oh, wasn't that nice? We used to have a relationship and now we have to start all the way over and figure out who these people are. To answer your first question, though, I think just being aware of what pillars exist in that community. Are there churches in that community? Are there small businesses? Are there community centers, schools? And doing what Mary Claire does and just asking those questions of, hey, I just wanted to reach out. I'm such and such from this place, and I'm doing some research. I'm wanting to connect with the community. Who would you suggest I reach out to? Or what are some things that I should know about the community as, an outsider coming in, or someone who's truly wanting to engage and know more? Who should I engage with? I don't think there's any wrong door in most communities. They're going to lead you to somebody or several somebodies, or even choosing to make yourself aware of, are there neighborhood associations that are meeting in this community? And being vulnerable enough to show up to one of those neighborhood association meetings and listen, because chances are there's somebody in that space that's going to tell you who can do what and who's willing to talk about. There's storytellers in every neighborhood. What was your second question? How to stay engaged and be prepared? Asking those questions when you're in front of those individuals, so this is what I'm here for. I'd like to learn more about this. What would work for you in this relationship? If I'm going to come in and I want information, what do you need?
what hasn't worked in the past when someone's come in before. So truly just being vulnerable enough to ask that question and to leave space for whatever their answers are. And then just commit to that. If you say that I'd love to stay connected and I'd love to meet biweekly or a couple times this quarter, truly stick with that. I think that something that is transparent community after community is holding somebody to their word. Maybe some people aren't as trusting, but if you tell me that we're going to meet, I expect us to meet. If you tell me you're going to call me, I expect you to call. And then also, if something changes, being open and honest about that too. Hey, listen, this was our original plan. Something's changed, and I just want to be upfront and share that with you. But just choosing to be thought partners together and learning from each other along the way. And then the third part of your question. All right. Oh, compensation. I think that that can be discussed too amongst the certain people of the community, because depending on who you ask, I do think that is very generous to want to compensate someone for their time. And something I see common, maybe like gift cards or raffles or, something that makes it fun. But I would say just be careful not to make it too transactional, because I think that can almost feel kind of like cheap or, well, this is what my time cost, or, but I do think it's also appreciated. So leaving room for that in the discussion about like how or what is an appropriate way to compensate individuals for their time if we're going to do some sort of compensation, because I think they'll be honest with that and tell you what could be appropriate or what somebody would find useful.
I want to be respectful for everyone's time, and we've got just a few minutes left, so I think we're going to end here. I want all of us to thank our gracious panelists for taking their time today. And I believe Tim and Dr. Menakemi have some closing remarks.
First, let me thank Tom for being our great moderator. That was very, very well done. You can tell he's been teaching for a while. And I really want to thank our panel. As someone who's coming from Washington, who's trying to learn, I really felt like I learned a lot of new things from this panel that really show some great examples of how we should be interacting with community. And I can't thank the Fairbanks School of Public Health enough and our panelists enough for being willing to do this, because we have a lot more that we have to learn. And when I say we, I mean everybody in this room, everybody on the Zoom and beyond, about how to work with community with humility. And we certainly have heard some great examples today. So thank you.
I also just want to echo my thanks to all the panelists for just their candor, their willingness to be here. But I have to shout out our student. Alexa, you did amazing. I could tell you, I was an undergraduate student. There was no chance I was going to be convinced to do what you're able to do so easily and smoothly. And we are so proud of you. I just also want to just say, we are sort of at a crossroads. I think there's a lot of challenges out there given the environment, but at the same time, when I sit and reflect on some of the things that were shared, I'm very optimistic that there's so much that we can continue doing in all schools of public health, but at Fairbanks School in particular. There's lots of path forward to deal with the ongoing issues that we're dealing with. And I think it's through collaboration and through partnerships and through listening and talking. And I love all the themes that kept coming up. We will continue to work hard to try to live up to that as a school of public health. I know our university is equally as committed, and we're not always going to get it right, but we're always going to continue trying to do what we're here to do. So thank you so much. And thank you all for being here to participate in this conversation. Thank you.
Thank you guys so much. It's fantastic.
Thank you so much.
Both of your works were just so of the community. It was so helpful to have you here.